We presented at the San Antonio Breast Cancer Symposium 2024 the results of our investigator-initiated clinical trial DECRESCENDO. So DECRESCENDO was a trial about de-escalation of chemotherapy in patients with HER2-positive early breast cancer. And the rationale behind this trial is a very important one because we know that patients with HER2-positive breast cancer tend to have excellent survival outcomes when treated with anti-HER2 therapy. And we also know that chemotherapy combinations, especially the use of anthracyclines, can have irreversible and sometimes serious long-term adverse events. So DECRESCENDO was an investigator-initiated Phase II clinical trial that included patients with HER2-positive breast cancer, hormone receptor negative, node negative, and with a tumor size between 15 and 50 millimeters. All these patients were treated with a neoadjuvant treatment consisting in paclitaxel plus Trastuzumab and Pertuzumab, and all these patients undergo surgery. After surgery, the adjuvant treatment was chosen according to the response observed at surgery, namely that patients with a pathological complete response could continue with just Pertuzumab, Trastuzumab up to the completion of 1 year of treatment, while for patients with a residual disease at surgery, these patients could receive a T-DM1 in the adjuvant setting, and if they had an important residual disease, namely a residual cancer burden of 2 or more, they could receive anthracycline before receiving a T-DM1 in a sort of salvage chemotherapy for these patients. So what we presented at San Antonio were the results of the first 139 patients included in this trial. The primary endpoint of DECRESCENDO was the relapse-free survival at 3 years for the patients with HER2-enriched PAM50 molecular subtype. And this gives me the opportunity also to say that we collected all tissue biopsy at baseline, and we performed the PAM50 molecular subtypes on these tissue biopsies. So coming to the results, of these 139 patients included, 131 underwent surgery. And on these patients, we observed a very high rate of pathological complete response, 86%. And if we observe at the distribution of the PAM50 subtypes within these patients who achieved a PCR, the majority, as expected, were HER2-enriched PAM50 molecular subtype. But interestingly, there was also a proportion of patients with basal-like tumors, 13 cases, that achieved a PCR. And this is interesting because basal-like is a molecular subtype where you don't really expect a big response to anti-HER2 therapy. If we look at the results from the other perspective, so how many PCR were achieved within the patients with an HER2 enriched PAM50 molecular subtype at baseline. Here the proportion of PCR is even higher because in these patients it was 89% PCR. So overall, we can say that although these data are of course very preliminary, only on 131 patients, in this cohort of patients, actually an anthracycline-free regimen in a very selected population of hormone receptor negative, HER2-positive breast cancer patients with node negative disease resulted in a very high pathological complete response rate. And as expected, the majority of these patients had an HER2-enriched PAM50 molecular subtype. We didn't present any survival data so far because, of course, these data are still immature, but we plan to collect these survival data and hopefully to present them at one of the upcoming conferences when the follow-up will be mature.